Hello, welcome to Adapt NCLEX. Today I'm going to show you guys how to use my B sharp not expected um, strategy to answer prioritization question. Your exams is full of prioritization. So if you master this technique, any prioritization question will be easy for you. This is not 100%, but it's a guide to help you focus as to you try to eliminate wrong answers. I know everybody try to do ABCD, ABCD, but sometimes the ABCD doesn't let you think. This is B sharp usually give you information you should look for, specific symptoms you should look for. When you see it, you know that is a priority. And the idea is to be sharp and not focus on unexpected finding as you evaluate your patient who need to be prioritized. And that is real life. This is what we do in real life as you take care of patient. This is not for your exams alone, but when you go to the floor to start working, you start using these prioritization skills to be able to take care of your patient. So I hope you listen carefully and apply it as you go to your Q bank, as you learn, and you see how you can use it to answer almost every prioritization question. So the B in the B sharp is a breathing problem. So this is breathing problem. People get confused with a breathing problem. You know, your lung usually is supplied by these tubes, which we call bronchi, trachea, and that carry air from your mouth all the way into the lungs. People who have a breathing problem, they have issues with the cage surrounding the lung, such that there may be fluid in the lung, outside the lung, that is affecting the lung from expanding. So those things can affect the lung from doing its normal job, or there can be air outside that is pushing on the lung, or you can have pneumonia, lung parenchyma disease. All these things can affect your lung, and these are what causes the breathing problem. So any patient who have this problem is a priority. The next one is electrolytes. This is very important. Your examiners like asking this because electrolyte control your hemostasis. And the key electrolyte is sodium, magnesium, calcium, and potassium. This control your hemostasis, basically allow your body to function in a normal way. Therefore, when the levels of these electrolytes goes up or goes down, they become a problem. So in your questions, check for normal high levels of this and pay attention to them as you go to evaluation and prioritization question. The S is in two forms, is sepsis or shock. And I'll break it down for you. Sepsis is a severe form of infection. But before you get into sepsis, you go into something we call SIRS, systemic inflammatory response system, where your heart rate goes up, your temperature either goes up or down. So look for low temperature. So temperature, what I mean low is really, really hypothermic, 95 degrees, 96, or the temperature is high. So when it's febrile, or your respiratory rate goes up, tachypneic, such that the individual CO2 goes down, down. You blow down all your CO2, or your blood pressure start to drop. These are signs of systemic inflammatory response. Your body is responding to that. And this is leading to sepsis. You can have severe infection that can put you in this state. Shock is what we call hypoperfusion state. Hypoperfusion. So generalized hypoperfusion. So most of your organs is not getting enough blood to flow. And so you go into shock. And mostly your blood pressure is very low and your heart rate is very high. Patient can have change in mental status. All these things, you should pay attention to that. The examiner is not going to tell you this patient is shock. You need to start thinking like examiners. As they write these questions, they want you to think like them instead of being a student. And so pay attention to when they give you these numbers, they're leading you to a pathway that you should pay attention to. The age is hyperglycemia or hypothermia. Usually when your sugar is low, so low glucose, when sugar is low, neurologically, you don't function well. And so look for hypoglycemia when the patient starts sweating, palpitating, uh, um, dizzy. All these things is a priority things you should watch for. Hypoglycemia or decreased temperature. When you are hypothermic, remember, low temperature will push your heart in a cardiac arrhythmia. So hypothermia is not just hypothermia, it can affect your cardiac function. That's why it's a priority. And of course, the airway. Airway is always number one, no matter what. It's number one. And the examiner usually try to trick you. And this is what people get confused. I told you the lung itself, lung parenchyma, and the things that surround them when they affect the lung from expanding is breathing. But the tube that's bring air into the lung is the airway. So when you have tracheal problem, we have upper airway laryngeal problem, we have a bronchial problem. This is an airway. So when there's a blockage here, air cannot go inside. So that's why it's a priority. And patients usually present in a drooling form. They will be drooling or they will be grunting or they will be striding. So they may have stridor, okay? So this is upper airway problem. So this patient may stridor, and therefore when you see these drooling, grunting, and stridor, think of airway as your priority. The R is in multiple fold. Examiner try to trick you. I see the R as a neurological problem, but how does a patient present when they have a neurological function is affected? They may be lethargic, okay? And then they may have acute mental status change, okay? And then they may have a seizure. Sometimes they will put you sunken eyes. Oh, sorry, sunset eyes. They put sunset eyes over there. That's a sign of increased ICP. And that is the signs of neurological problem. I forget one thing on the airway. Sometimes they will give you restless. A patient is restless um, may have an airway problem. And this one to neurological, a grunting patient may also have neurologically, they cannot function because they're not getting enough air into their brain. And so they will present like that. So look for lethargy, acute change in mental status, a patient who just had a seizure, a patient who's grunting, or you have a sunset, sunken eyes. You should pay attention to that. It's a neurological problem. The last one is the P, which always kills students. Pain, we all have pain. You can have, every patient has pain. But the pain that is a priority is pain that will make you lose your limb. You're going to lose your life or organ or lose your eyesight. And that's what life, limb, eyesight. Pay attention to that. Life means you have pain that will make you lose an organ. And mostly if you're going to lose an organ and losing your life, it's an ischemic pain, like you have a heart attack and it becomes ischemia, and then you can lose your heart and your life. You can also have a pain in your abdomen, severe infection, such that there's ischemia. okay, the bowel is twisting and you have pain such that you have peritonitis and you be guarding, or you may have broad band-like abdomen, or you may have rigidity from that pain. That's an ischemic like kind of pain. If you don't do anything about it, you may die from it. You can have pain from your leg from a cast. And this kind of pain is an ischemic kind of pain. And if you don't do anything about it, patient is going to lose the alarm. You can have a glaucoma that will increase the ICP of your eyes. That's what it is. And if you don't do something about it, patient may lose their eyes. Or you can have retinal detachment, acute onset, and this pain need to be taken care of right away, such that if you don't do anything, they may lose their eyesight. So life, limb, eyesight kind of pain is a priority. So we're looking to be sharp, not being expected. So breathing, electrolytes, sepsis and shock, hypoglycemia, hypothermia, airway that present in drilling, stridor, restless, and neurological presenting like lethargy, acute change in mental status, seizure, in sunken sunset eyes, and pain that is due that will cause limb, eyesight, and life. We're going to use these examples to answer a couple of U-word questions, and you see how you can apply them. So let's try a couple of questions and see. So this is a priority question because you can tell because of the first. Usually they will say first, which do you see next? So this is a priority question. Which client should you the next assess first? So we have 4 patients. What I do is read it and see if it's an expected or a B sharp issue. If it's a B sharp issue, I pick it. If it's a expected, I drop it and I keep on going down. So a client who has shortness of breath from moderate pleural effusion is waiting for thoracentesis. As I told you, you have your tubes going into your lung, and when you have fluid around your lungs, here they can push on your lung and it can prevent your lungs from expanding. So patient is having, if you have fluid here, you should expect this patient to have shortness of breath. So this is an expected finding, even though we got to take care of it. It's waiting for thoracentesis to remove the fluid to allow the lung to breathe. So pleural effusion should leave the shortness of breath. So we should expect this to be normal, expected finding. A client who has a long leg cast applied and a severe pain despite a dose of morphine. So this is his leg. He has cast in place and he still has pain no matter what pain medication you give them. That's the clue. Pain unrelieved by morphine of the leg is a sign that there may be what we call compartment syndrome. So this patient is having compartment syndrome. It's just telling you that their pain is not due to a nerve problem that the morphine can take care of. It's due to ischemia, and ischemic pain will make you lose your lung. And therefore, this patient is a priority for now, but we should eliminate one and keep this. A client with cellulitis who is receiving first dose of antibiotic as a sore tightness. So patient has infection, get his antibiotic, now he has throat tightness. That is the upper airway being tight. So if you block this, there will be no air going in. So this is a sign of an airway problem. Throat tightness is not just a throat tightness. This patient has an IV antibiotic causing throat tightness. That's the airway problem. So he's getting anaphylactic shock. And therefore, we will eliminate 2 and keep A. A sickle cell crisis client who has severe bone pain despite a dose of morphine. This is the same thing as the second one, but it's different. Sickle cell patient have ischemic kind of pain, but their ischemic kind of pain will not let them lose limb, eyesight, or life. It's an expected pain, and when you give them pain medication, it may not go away. Of course, these patients need to be taken care of with pain medication and fluid, and therefore this is an expected finding. And what we left with is number 3, who is having anaphylactic shock. And therefore, that's our answer. We'll continue with the next question. We're going to use the same thing and analyze the question the same way. Which resource is the highest priority to report to the healthcare provider? And next, review most current serum laboratory results for assigned patients. So for patients, they have lab value, and we want to see who we need to report. Albumin of 3.0 in a client with chronic liver disease. Your liver is responsible for making proteins. And one of the protein it makes is albumin. If you have a liver disease, chronic liver disease, you're not going to make enough protein, and you're not going to make enough albumin. Therefore, this is an expected finding. The normal level of albumin should be greater than 3.5. This is an expected finding. We are looking to be sharp, not to be expected. BMP of 400 in a client with a heart failure. So your heart, when you have heart failure, you have a big heart like that. And then when a heart gets bigger, it stretches and releases this hormone called BMP. Normal level is greater than 100. When your level is greater than 100, we call it that you have heart failure. If it's greater than 100, you can have 1,000, 5,000, 6,000, 400. No matter the level, so far as it's greater than 100, we say you have CHF. And therefore, we expect patients who have heart failure to have a BMP of greater than 400, greater than 100, which is 400. Therefore, this is an expected finding. Magnesium of 1.7 in the client with alcohol withdrawal. Alcoholic have micronutrient deficiency, and one of the micronutrients you should pay attention to is magnesium. They have low level of magnesium because of nutritional problem, because the kidney get rid of it, and therefore alcoholic, you expect their level to be low. This normal is 1.7. It's still is in normal range. Usually 1.5 to 2 is normal, but it's in the low normal range. And therefore, we expect this to be normal finding for somebody who is alcoholic. And so we have eliminated 1, 2, and 3. So we left with 4, which is should be your answer. After you've gone through the B sharp, should be your answer. But let's see. Sodium 120. I told you, electrolyte imbalance. Sodium in a client with small cell lung cancer. Patient who have small cell lung cancer, the cancer secrete ADH, high level of ADH. Therefore, these lead to SIADH. What the ADH does is it causes reabsorption of water, so water retention, and the patient will develop dilutional hyponatremia, and your sodium goes low. Remember, whenever you see hyponatremia, think of ICP, because the brain swell, and if the brain swell, this patient goes into seizure. That's why hyponatremia is very serious. These patients' sodium need to be corrected slowly, and therefore this become our priority is in B sharp. You have electrolyte imbalance there. You have neurological problem, and seizures. You see how you can connect the electrolyte into the neurological problem. Patient will become lethargic and will develop into seizure. And therefore, this is our answer. We're trying to be sharp, not expected. So that is our answer. We continue. Next question. See. The same thing. We have a priority question because of the word first. Which client should the nurse assess first? This is an emergency department. Nurse is assigned to triage this. So put yourself in that situation. You are an emergency nurse triaging 4 patients. Who do you assess first? You have to be shocked when you see these 4 patients. Not expected. Don't look for unexpected finding. 5-year-old with the superficial leg laceration. You have the 5-year-old, this is his leg. He has laceration here. We don't have evidence of hemorrhage. We don't have evidence of infection. Nothing in our B sharp. Therefore, all we know is his cut is laceration. Therefore, expected. Our sign expected. Lethargic, you see, neurological problem of a 3-year-old with diarrhea in the past 12 hours. The 12 hours is not the problem. It's been dehydrated. Now it's in a lethargy mode. Neurologically, it's not function. That is a priority. So this is a priority patient. 7-year-old with elevated temperature and hematuria, blood in the urine. All we told is he has fever and blood is urine. This patient may have UTI or glomerulonephritis. I don't see any evidence of SARS phenomenon. Just one temperature is not enough. I have to see all the information in sepsis. Therefore, we can eliminate this and eliminate this. Last one, 17-year-old with severe acute abdomen. This is serious. The patient has a severe acute abdomen. There may be some peritonitis, may have garden, may have rigidity. So that may be sepsis going on. But we cannot, a patient who has a neurological problem is more important than this patient. We don't have any information. All we have is acute abdominal pain. We don't know if the patient is in shock already. All we know is abdominal pain. May have appendicitis, but I'm not bringing that in. I know he has acute abdominal pain, but a lethargic patient is more serious than that. So we'll pick that one and see. You see, 27 people picked that because of that, but that is our priority answer. So we see if we can see one more, and then the same thing. You have a couple of patients. Who do you prioritize first? 4 patients in the emergency room. Who do you see first? So you're looking for being sharp. A 12-year-old, right lower quadrant, abdominal pain, that started in the periumbilical. If this is your abdomen, this is your belly button. Appendix is on the right side. Your sigmoid is on the left side. So diverticulitis is here. Appendicitis is here. Appendicitis usually start in the periumbilical, around the umbilical, and move in this direction. So this is an expected finding for a patient who have appendicitis, periumbilical going to the right lower quadrant. It's an infectious process, but we don't have any evidence of patient being septic or in shock. Therefore, having right lower quadrant pain for appendicitis is unexpected. A 14-year-old with severe scrotal pain, right testicular tenderness, swelling and more elevated elevated than the left. So you have patients who have big scrotum on the right and the left with the left side elevated, right side elevated than the left. This is a problem. You can see there's so many things going on. This is swollen, this is elevated, and it's tender, and it's very severe. The patient is having pain, but this kind of pain is an ischemic pain. The fact that the scrotum is elevated than the other one means this, the testicles is being twisted, and that is what is leading to elevation of the testicles. So you have ischemic kind of pain twisting the testicles, And this patient, if you don't get away the pain, the patient will lose their testicles. So that's the ischemia. And if pain, this pain will lead to loss of organ. A loss of organ is a priority. This is what we call testicular torsion. Therefore, this pain is not just a pain. It's a pain that will lead to loss of organ. So it's our priority. A 16-year-old sickle cell patient with excruciating pain, generalized body pain. Sickle cell patients have pain all over. It's due to ischemia, but they never lose their limb, life, and eyesight. Therefore, this is an expected finding. A 34-year-old with a sudden right-sided flank pain radiating to the right groin. This answer choice is tricky, but they've given you all the classic signs and symptoms. This patient also has pain, but this pain is not life-threatening, it's not life, they're not going to lose organ, they're not going to lose any eyesight. This is a classic symptoms of kidney stone. They have sudden onset, right-sided, and radiating to the groin. Your kidney is at your back, and it connects to your bladder in front. So when you have kidney stone, it moves from your back, it goes to your flank, into your groin, into your bladder. And the symptoms are very severe, but you don't have obstruction enough to cause your kidney to die. So that pain is not ischemic for you to lose your organ. Therefore, this is an expected finding. It's classic symptoms of kidney stone. And therefore, we'll pick number 2 as the right answer as our priority, since we're looking for being sharp instead of being expected. And as you can see, 32% people choose this because it's very tricky because of sudden right flank pain radiating. It has all the buzzwords, but this is the priority patient you should worry about. So, like I said, you have to be sharp. Don't be expected in every priority patient. I hope this help you go through your learning process. If you like this video, like it so that I can grow my channel. I'll be making more video for you guys to study, but you can beat these exams. The only way to beat it is to adapt and have some tricks and tips to take care of it, and be sharp, not expected when you see a priority question. Good luck in your exams.